Okay, so I guess we'll get started. Let me introduce myself. My name is Louisa. I've been an esthetician for almost 30 years, actually a little bit more than that, but I've been working with Dr. Tehrani for about 10 years now, and we do all the laser procedures and skincare treatments. Um, so today we're going to talk about, I need to turn the page. Okay, so click here. So we're going to talk about non-invasive procedures today, things that we could do in the summertime or things that we could do that has minimal downtime. And so the top three concerns are fine lines, wrinkles. As we age, our skin loses elasticity and we get some sun damage due to sun exposure. And then it happens on the face. The décolleté is a big area that shows aging, and the hands. We also lose lack of volume. We lose a lot of volume just because we lose fat in our skin, a teaspoon of fat every year after a certain age. So we end up with skin that kind of just drags. And we use skin also in our hands, anywhere on our bodies. Unfortunately, it stays around the abdomen. And the last thing, a lot of things that people concerns are acne. A lot of people get acne as they get older for some reason, not as much as when they're younger, and it's due from hormonal change and dead skin cells that don't exfoliate as often as it did when we were younger. Okay, so we want to treat all these things. Unfortunately, the first picture that you see is you don't want to wait until until the problem gets really bad to start taking care of our skin, because we can't turn back the age. You can't turn back the clock. So we want to start when we just start to see fine lines and wrinkles. We want to start when we see some pigmentation from sun damage and from what we call it PIH, post-inflammatory pigmentation, where you get like a little brown spot after, let's say, an acne lesion goes away. So we want to start when you see them. Okay, so some of the treatments that we have is Giovanna saying anything that we need to look at? Um, so some of the things that we can do is ultherapy, and it helps to tighten the skin. It uses ultrasound to help to um, lift some of that skin around our jowls, and it gives you like a nice brow lift. It also helps with the décolleté. You know, when you're sleeping, and if you're sleeping on your side, by pressing your breasts together when you're sleeping, it causes a lot of crepiness around our décolleté. Um, so we want to treat that area. And ultrasound, therapy is a really good option. And there's a little bit of pain involved, but we can give you something to make you feel more comfortable to help to help you not feel that pain. Thermi-Smooth. Thermi-Smooth is a really good option to help with tightening crepey skin. So it's not going to give you a bluff. It's not going to lift skin. But if you can hold your skin and it stays for a couple of seconds, then you're a good candidate for Thermi-Smooth. And what it does, it's like a heated element that we use to help to massage the area, and we have kind of like heat up the tissue for a period of time. We need to get it to a certain temperature, and we go over that area, and it helps to tighten that skin. You need to do a few treatments, so we could use it for the lips, we could do it for the jowls here, but basically it really works the best, I think, for the eyes. And that's a quick treatment. There's literally no downtime. It's almost like getting like a little bit of a stone, like a warm stone massage. That's what it feels like. And you do it every 2 to 3 weeks, and it's we usually like to do a series of 3 treatments. The woman that you see here had 4 because she had some extensive. She needed really a little bit more work, but she really is a candidate for a bluff. But she didn't want to do it. She wanted a non-surgical option. So the woman that you see here had 4 treatments. So other skin rejuvenation treatments that we do is Fraxel, and we have the Fraxel Clear and Brilliant, which is great as a maintenance treatment. It's good to use during the summertime, and we have the Fraxel Restore here. So the Fraxel Restore helps with more deeper wrinkles, and it helps to even out some pigmentation. So you can't put makeup on for 3 days after each of these treatments, and you have to put sunscreen on when you're going out. But this is good for just about any skin types. So a lot of lasers, you have to be careful of what color your skin is. With this one here, because it's fractionated, it's safe for all skin colors. So we have acne treatments. The acne treatments that we could use actually in the Manhattan office, we have the Smooth Beam. And in the Great Neck office, we have a Cyton acne treatment. It's a light treatment that helps with P. acne bacteria. So both of them help with the P. acne bacteria, but the Smooth Beam particularly will help with some of the scars that's left behind. It'll help to smooth it out. So you need to do a few treatments. It's a series of treatments, and it'll help to smooth out the scars, and it'll actually help kill the P. acne bacteria. We also have another acne laser in Manhattan that we just got in. It's called the EMAX. It's made for active acne, and it helps to kill some the bacteria, and it also helps with the building collagen in the areas that you've had some indentations that's left behind from the acne. Hydrafacial is also, it's nice to do in the summertime. It's nice to do anytime. It's a nice relaxing treatment. It helps to unclog pores, helps with oiliness. It's like an intensive facial. It forces some hydration into the skin and exfoliates at the same time. And then we have different serums that we can put in there, boosters that can help with for aging and some acne. You could choose the booster that you want. Chemical peels. I love chemical peels. We did a webinar on chemical peels a while back. You can refer to it. But we have different peels that are made specifically for different skin types and conditions. But basically, what chemical peels do, it actually helps to unstick the glue that holds our skin together. The top layers of skin then kind of gradually lift, and it forces your body to make new skin underneath. So you're left with such new, soft, glowing skin, like baby skin. BBL, a BBL that we have is a Cyton BBL, and I love it for pigmented areas like the décolleté, the hands, the face. Ideally, it's really for skin types 1 through 4, I would say, limited 4. So much lighter skin. You get when you do the treatment for the pigment, after a couple of days, those brown spots kind of get darker, and then over a few days, it just flakes away. It looks like coffee granules just flaking away. It also helps with broken capillaries on the face. And it'll help to just give you a nice, smoother, clearer complexion. You look like porcelain when you're done with a series of treatments. So PRP with microneedling. So we have a few things that we could do with PRP. Microneedling, we do it on the face, and it helps. We use this pen that kind of put like these needles into the skin, and it goes really fast on our face. We could do it on our face, we could do it on our neck, we could do it for acne scars, we could do it on our décolleté, we could actually do it anywhere on the body. We could do it all for scars on the body as well. And the microneedling with the PRP uses the plasma to help stimulate cell growth or new growth in the area. So it'll help to induce some collagen and help to induce skin growth. So it uses our own collagen to help heal the skin. Sorry. Okay, injectables. Injectables you could do any time of the year. You get a little bit of swelling depending on the area. So we're going to start with neuromodulators or Botox as you know it. So Botox was the first kid on the block. Everybody knows Botox. We also use Dysport, and Dysport is also does the same thing as the Botox as all these, and Xeomin. And Jeuveau is a new kid on the block. So they all do the same thing. They all stop those muscles from moving. So if you have a lot of movement in your forehead, you got some crow's feet, any of these items would work for you. Xeomin and Jeuveau, I think, has less fillers in there, as the companies say, and it works. A lot of younger people like to use the Xeomin. So the areas that we can address is it helps to lift the eyebrows, helps with the crow's feet. Some people have the nasalis here when they have those little bunny lines here. Forehead, of course, and this here, the glabella. The dimpling of the chin. It also can actually help make the ends of the lips kind of go up a little tiny bit with a little bit of Botox. And a lot of people have these platysmal bands that pull the skin out. So these platysmal bands actually, if we put a little bit of Botox in there, it'll help to flatten it so those bands don't stick out. Fillers. So we have a lot of choices for fillers, and we use different fillers for different areas because some of the fillers give you more volume if you need volume, and some fillers give you more mobile, so it feels softer. So for like the lips, you want something that's going to be a little bit softer so that you don't feel like you're kissing a rock when or you feel like you have like really big lips. And there are some fillers that actually help to stimulate collagen. So it depends on the area that we're working on and what we ultimately want to achieve. So here we go. The top right picture, the blonde woman had some filler under the eyes for the hollowness. So a lot of people, as we age, what happens is that the fat pad that we used to have around the eyes kind of like falls. So we're left with a hollowness. So if you add a tiny little bit of filler, we would use a hyaluronic acid just to kind of like fill up that little hollow. It'll help with the darkness around the eyes. And then the picture on the bottom is a woman had a little bit of filler on her cheeks and in her marionette line, so you can see. So there's many different areas that we could use filler for. We could use some definition for the cheeks, as we said, around the eyes, around the lips. We have this a new filler right now that everyone's crazy over called the Kiss. And it's a hyaluronic acid, and it's made specifically for the lips. It's nice and mobile, and it gives you some nice volume without overdoing it. Okay, so let's going back to the skin. A lot of our concerns, what we want to do at this time of the year, we want to exfoliate the skin, we want to moisturize, and we want to make sure that we put SPF on. So we've just launched some of our non-invasive treatments as packages. So we combine a few treatments and we use for our signature packages. So our 24 karat glow is a nice treatment. We do a deep clean cleanse. We use our products that help to exfoliate the skin and clean the skin. And then we use something called a dermafile. It kind of gives it like a nice polishing. And on the tip of the dermafile, there's a crushed diamond on the tip. And we use it on the face and just to exfoliate. And we go up and you can actually see some of the skin kind of exfoliating. It's a nice treatment. And then we use Clear and Brilliant, Fraxel Clear and Brilliant on afterwards to make these micro little channels into the skin. And it helps to forces your body to make new skin through those little channels that we just made. And it helps to lighten up some pigmentation. It's good for like fine lines that we get around our eyes, around our lips. We use it a lot. And it's, like I said, great to do it during the summertime. It's a great maintenance treatment. So you get your skin nice. It helps to keep your skin glowing, and it helps prevent some wrinkles. And then at the end, we finish it with a gold mask that helps to hydrate your skin and remineralizes your skin. We actually see brightness in your skin immediately after the treatment. So the next treatment that we just started is the Quick Beauty Fix, and we start with a laser genesis, where it kind of like does like a micro exfoliation. It helps. It's great for people who have some rosacea, a little redness, and then it gives it helps with oiliness around the nose. It's great for people who have like large pores. That's a great treatment. That's a go-to treatment for people who oiliness and large pores. And then we continue with the Skin Tight. That we use a Cyton Skin Tight, and when we treat the cheeks, the jowls, and our neck with that treatment, and it helps to stimulate some collagen, and you'll see an immediate like lift in the skin. And then we finish with a lymphatic face and neck massage. It's probably about a 45-minute to an hour treatment. And when you're done, you feel nice and relaxed, you feel clean, and you feel like your skin is kind of like lifted. So now the ultimate pick-me-up is the next treatment that we have. So we start with a deep cleanse, and we do this micro collagen. It's an ultrasound that we use to help to stimulate some collagenesis and some tightening. It's I guess about a half-hour treatment just for the current. And then we'll end with a lymphatic upper body massage. So it helps improve your circulation. And you'll actually notice some swelling. Some people have like puffy eyes, and it just helps with the puffiness on the eyes. And it gives you some nice color in your face when you're done with the treatment. Of course, then we end with a sunscreen and a moisturizer. So the next one is Skin Addict. So we do another deep cleanse with this. We do a micro needling. So you have a little bit of redness on your face when you're done. And then we use like an enzyme at the end for the dead skin cells, and leaves your skin nice and soft when you're done. Like I said, you're going to be a little bit red after the treatment because you're doing some microneedling. And in order to get a result from a microneedling, when you're doing a microneedling, we got to see like a little bit of pinpoint bleeding, a little redness or erythema. It lets us know that we're actually at treatment level. And it's great for wrinkles. It's great for scars. If you have some acne scars, that's our go-to treatment. So the next one is our New York Skin of Mind. So we'll do a deep cleanse with our products, and we do this in the Manhattan office. We use something called a dermafrac machine and microdermabrasion, and the microdermabrasion will exfoliate all of your skin. And then the dermafrac does these little tiny needles, and then it infuses these hydration into the skin. and you're left really feeling like plump and smooth. And then we end with a gold mask that helps to remineralizes the skin. And we do an SPF. Now here is our beautiful Giovanna. She works in our Manhattan office. She's our esthetician in our Manhattan office. And I'm just gonna show you, you'll actually see a little tour of the Manhattan office, and she's gonna talk about the New York Skin of Mine treatment. Oops. How do you do this? There we go.
Hi, I'm Giovanna, and I'm your esthetician here in New York City of Mr. Plastic Surgery. So we're going to do a dermal treatment that includes microdermabrasion and microneedling. So today we have Carla here. So she has dry skin. She's a dry skin type. So today we're going to be doing a hydration treatment. Now, dermal is have different solutions. There's one for acne, there's one for anti-aging, and there's one for hydration. So today, Carla does the hydration, and that's what we're going to be doing for her. What we do is we cleanse the face with our daily cleanser, and when you get professional treatment done, you want a double cleanse. So this is our first cleanse. Our next cleanse is going to be with our deep cleansing scrub. So this is our dermaprac. So the first step is the microdermabrasion. So all you do is put this on, the suction starts, and we're going to start slugging off some dead skin. So this is a dermaprac solution for the hydration. And this has hyaluronic acid in it, so it's really good to penetrate down into the dermis. That's what the microneedling does. Next is our hydrating 24 karat gold mask that promotes the younger looking skin. Then we top it off with our moisture trench and our medical grade SPF.
There you go. That was our treatment, that our New York Skin of Mine treatment. And then there we go. If you have any questions, anybody? Actually, this week we're going to have 30% off of all of these new packages that we have.
Oh yeah. So hey guys, this is
Hold on, let me put
Jacqueline.
the volume louder.
So I think that it might be best to have some of you guys write in questions in the little chat box to the right-hand corner. And you know, we also had a couple people write in their questions through email and some through Instagram. So I'm just going to read them out loud, and then Louisa, maybe you can answer some of these questions for us. So the first question, Louisa, we got was, how can you treat freckles and melasma?
So freckles and melasma. Melasma is a very difficult condition to treat. Melasma is hormonal, and for a lot of people, melasma never goes away. You can only just keep it under control by using certain ingredients like hydroquinone and a retin-A mixed together, or something called arbutin that we mix for you. So it's products that we mix for you in the office that you have to be on it on a regular basis. So melasma is a little bit more difficult, but we can keep it under control, and we can help with the flare-ups. So you'll have some flare-ups when you have stress or heat can cause it, and can make it worse at times. But we can try and keep it under control with products. As far as freckles are concerned, or sun damage, we can definitely use some of these treatments, of some of these laser treatments, some of the BBL, the Cyton BBL that we use. that'll definitely help with it. It'll help to keep that, to lighten up that pigmentation, and we can make it go away with a lot of that with the Cyton BBL. Also using home care definitely helps.
Okay, awesome. So basically you would just give it like an all-in-one treatment. We come into the office, treat us with some lasers, maybe, and then follow up with home care, you think, for the best treatment.
Absolutely.
Awesome. Okay. We have someone else who's written in. She said, what is a thermal treatment that helps with the eyes? What is it called again?
Well, that's the Thermi Smooth. So it's a radio frequency. We use a little gel to go on the area, and we kind of just, it's like it feels like a little warm stone massage, and that actually helps to heat up the underlying tissue. That will help to stimulate some collagen. That'll help to tighten the skin around the eyes.
Okay.
We usually do a series, usually 3. The woman that was pictured had 4 treatments, but we usually do between 3 and 4 treatments. And we like to do them between 3 and 4 weeks apart.
Got it. Okay. And is there no downtime after that?
Absolutely 0 downtime with that. You can go, you're not even red, nothing when you're done.
Okay. Okay, great. Okay, I think, yes, person said that she answered it. Good. So next question, is there a topical anesthetic used for any of the packages that you mentioned?
So the microneedling one, yes, we do need a little bit of topical numbing. We leave it on for about 10 to 15 minutes. But the rest of the treatments, you do not need a topical anesthetic at all. There is no pain for any of the other ones.
Yeah, more of like relaxing treatments, if anything.
Yeah, exactly.
Right. Cool. Someone said that they did a topical skin cancer treatment recently in liquid. What would be the treatment for skin pigmentation?
So that they had some cancer cell removed. Is that what you're saying?
Yeah, Claire, do you think you are able to clarify? Yes, she said that that's correct.
Okay, so for people who've had some squamous cells or precancerous cells, it is really important to do certain laser treatments to help keep that skin exfoliated and rejuvenated. It's imperative to stimulate your body to make new cells. So exfoliating on a regular basis, like doing a micro laser peel, doing chemical peels, is really important to do on a regular basis. I do a chemical peel on myself about 3 times a year. And I think it is important for somebody who has a lot of sun damage to do that on a regular basis, because it's forcing your body to make new skin, to take off that old. And that'll help with the skin cancer. That being said, you really also have to go to the dermatologist on a regular basis to get those skin checks, because you want to make sure that new ones are not forming.
Gotcha. And then she said, what about Fraxel or BBL for that kind of pigment?
Fraxel or BBL, yes, you can. You can definitely do BBL on that, but I think exfoliating on a deeper level is more important. So you have to think of, yes, you do have some pigment, but you also have to make sure that, and topically, aesthetically, you want to take away the pigment, but you also want to make sure that you're removing some top layers of skin. So for somebody who has that kind of an issue, we need to look deeper into it. Instead of aesthetically, yes, we do need to aesthetically look pleasing. You want to take that pigment away, but you also want to remove the top layers of skin on a more regular basis.
Okay, gotcha. We have someone who wrote in and they wanted to know if we do Nova threads, and can you tell us about it, if there's any downtime or side effects?
Yes, we do Nova threads and we do silhouette lifts. So we have a variety of threads. And if you're gonna do we have like the Nova threads for the lips, and we have them for secondary lines, and actually even to lift the skin, and it works very, very well. So for the way it works is we put a little bit of lidocaine into the area, or topical numbing, depending on the type of thread that we're using. So we have threads that'll help just to give a little bit of a lift, some that'll fill in a little bit. So if we have like the the Nova twist works very well to give you a little volume for, let's say, around the lips, or we have the ones that help just for like secondary lines. We could use it in like a mesh to kind of like help to smooth out the skin. They work when you put them in. For the ones for the lips, you need to do them like 2 or 3 times, and the ones for lifting and to smoothing, well, actually, you could do them once, and it'll last for a good year to 18 months.
Awesome. And what about downtime or side effects?
So the downtime, you're going to have some swelling. So if you're going to use, let's say, the twist or the smooth ones, you're going to have some swelling for about 3 to 5 days. But if you're going to have the ones that really lift, like lifting, like the silhouette, you're going to have like a little bit of a pucker into the area where the exit area is, because you're using these threads and using these needles that are going to go in and pull the threads to kind of lift the skin up. You're going to have a little bit of a pucker, and that can last 7 to 10 days, I would say. So those are a little bit more downtime, but they work well with lifting. Not only that, those treatments help to build collagen in that area. So it's good for collagen building for down the road.
Gotcha. Thank you.
Mm-hmm.
Okay, so someone else wrote in, what treatment is best for hyperpigmentation on dark skin, and how many sessions would be needed?
So the best treatment for hyperpigmentation on dark skin, we have a treatment called the Pigment Peel. So it's a peel you're leaving with this mask on your face, and it should stay on for about 6 to 8 hours. And you go home with this kit. So over the next couple of days, you're gonna peel, and it'll just lift up a lot of that pigment. But it's important to remember, it's not going to change the natural color of your skin. It's going to help lift up the pigment that's left behind. And then you're going to go home with this cream that we mix specifically for you, that you're going to use over the next few months. And by the time you're done with the treatment, 90% of that pigment will be gone. Works amazing.
Awesome. Thank you.
Mm-hmm.
Okay, we have just a couple more that's people wrote in. Should I be cautious about doing laser skin treatments in the summer?
Yes. A lot of the treatments, you want to make sure that you're out of the sun. So the Fraxel Clear and Brilliant, like that for a weekend, you just want to stay out of the sun, but then you can go back to resume normal activity. So these packages that we did, there's no downtime, you don't have to stay out of the sun, but actual lasers, yes, you do. So hair removal, the Fraxel Restore, even the BBL, you got to be careful after you're done, after you do a treatment. You don't want to go in because you're going to feel more sunburnt after, and it'll make you more sun sensitive when you're doing a laser treatment.
Got it. Okay, good to know. And I guess,
I would say 2 weeks before and 2 weeks after a laser treatment, you want to avoid the sun exposure.
Okay, got it. Lastly, what are the best skincare procedures for men?
Oh, any of those packages do very well for men. because there's no downtime. Botox and neurotoxins are really good treatments for men because they tend to have a lot of frown lines, or they have a really heavy frontalis muscle where it makes them look really stressed. And fillers for like the malar area will help make them appear more youthful.
Okay. Yeah. Okay. Thank you so much, Louisa. I think that's just about all the questions that we had. Just a reminder that this week only, it's going to be 30% off all of those packages that she mentions, which is a really good deal. We usually don't even discount 30% off. So this week only, definitely give us a call, email us if you're interested in any of the packages. Louisa will be happy to answer any more questions. We're also offering complimentary skincare consultations with Louisa and our esthetician Giovanna. So you can even do a virtual consultation. We'll just get you on the schedule. And I think that's it. Thank you so much, Louisa.
Thank you. Thank you so much, guys. Thanks for coming.
All right, bye, guys.
Bye-bye.